Hi guys, I'm Kayla and I'm coming to you from Medic 1010. I work on the Sugar Creek Fire Department, and today I'm here to show you our CPAP protocols and procedures. I'm also going to introduce you to our new CPAP circuit. So we're going to go ahead and show you all the components of this. I'm going to go ahead and pull the CPAP down from our shelf, our airway shelf, and we're going to just go ahead and open up this new circuit. So you can see what's different with this new CPAP is not only is it a mask, but it also has a built-in nebulizer and also a built-in PEEP valve. PEEP stands for positive end expiratory pressure. So this is pretty neat to use. It's also very helpful to our patient. So if I go ahead and open up this mask, you're going to see as I pull out the different components, the head straps. It's very easy to make adjustments on this, and it's designed for easy use and also to make your patient feel comfortable. One of the most important things to remember is that you have a good mask to face seal. And so some of the ways we can do that is you can adjust this top piece, and you can see this plastic piece can slide up and down. It can also go in and out, so that's great. You can see all of our straps are also very adjustable. And not only do they have they have more than one Velcro piece here, so if you need to make it even smaller, instead of wrapping this all the way around your patient's head, you can actually just go ahead and use this second piece right here to tighten up your face mask. Some of the other things you can adjust on this are the bottom straps as well when you're putting this around your patient, and they're just going to snap into the bottom. Like we talked about earlier, is we want to make sure that it has a very tight seal. You also want to make sure there's no air coming in from it anywhere, so you want to make sure these little valves are closed, these guys right here. But we're going to come back to this later because we're going to be putting this on our patient. So our next piece that we're going to look at is our CPAP circuit. And you can see, as I show this to you, that it actually has a one-way valve, and this is for your nebulizer that we're going to use in it later. This also is our PEEP valve. It has 3 settings. It has 5, 7.5, and 10 for the amount of pressure you can use for your patient. So just a heads up on that. If your patient has congestive heart failure, CHF, you're going to go ahead and start your pressure at 10. If your patient just has wheezes, asthma, or COPD, we're going to go ahead and start at 5. Our next piece that we want to talk about is our actually built-in nebulizer. I'm just going to go ahead and open some of this up to show you. Oops. Okay, so it's very easy to use. You can open and close the medication chamber. Very easy to administer. You also can see where these ports are going to go right into your oxygen on your ambulance. So, for instance, if we're going to let's go ahead and set this up right now. So I'm going to start with just our basic CPAP. And we're going to take this port, and we're going to go ahead and take it right up here to my oxygen. You always want to start this at 6 liters, because this is very adjustable. You can easily adjust this. If you see the patient is still having trouble breathing, just go ahead and give them a little bit more pressure, O2 pressure. But for now, you'd start it at 6. Something else to keep in mind is we're going to have to talk to our patient to really get them comfortable with it if they haven't used it before. So what you're going to want to do is actually connect this first. And you're going to do this blue valve, one-way valve. As you can see, you want to have that facing down because we're going to attach our nebulizer, inline nebulizer to that. So if I tighten this right here, it's seriously that easy to use. You're going to have your oxygen. You want to have this going before you put it on your patient, because that way they can feel that pressure and you're not going to just blast them with a whole bunch of air. So I think that's pretty much all the components that we're going to talk about. Our next scenario, we're going to actually have a patient and we're going to use it on them. Alright, so today in our scenario, we have a 67-year-old male in respiratory distress. He currently has a history of COPD and asthma. We have currently obtained vitals. We have a heart rate, we have blood pressure, we have his pulse ox, and we also have attached a 4-lead. He's on a nasal cannula currently, but he's having a lot of trouble breathing. Just one thing to note, if this patient had heart problems at all, like congestive heart failure or anything like that, we would also need to obtain a 12-lead. But at this time, we're just going to go ahead and attach our CPAP to our patient and see if that's going to make him feel better. So, like I said, it's very important to talk your patient through this process. If this patient has already had this before, he might be accustomed to it and be much more comfortable. But we'll say that today he has not. So I went ahead and set our CPAP at 6 liters per minute. And this mask is ready to go. So, all right, Sarah, I'm gonna put this on your face. You're gonna feel a lot of pressure, and it might feel a little bit uncomfortable at first, but I'm gonna just place this on your face, and you just give me a thumbs up if it feels comfortable to you, and if not, just go ahead and just wave your arms at me, and we're just gonna do this nice and easy. This is gonna help you breathe a lot better. All right. So I'm gonna just go ahead and start, as you can see, from his chin up over his nose, and place this on his forehead. I want to put some pressure on to make sure that seal is beginning to get tightened. You can see there might be some problems if your patient has facial hair or broken teeth or something that might possibly damage the seal between their face and the mask. But I'm going to just hold this tightly. Now would be a great time to make as many adjustments as needed. So you might need to, move this top adjusting piece on their forehead back and forth a little bit. At this point, you're going to say, how does that feel for you? All right, he's giving me a thumbs up. So I'm going to go ahead and just take these straps and slide this behind the patient's head. And you want to just do one at a time. Needed. And these front pieces, super easy to use. They just actually snap onto your CPAP. So I got this one piece. All right, now I'm going to go ahead and attach a second piece. You might need to make a small adjustment or so. It is nice if you have a partner with you that can help you with this process, just so it takes two of you to kind of walk them through this and make the necessary adjustments to make sure this is nice and snug for them. And of course, you can adjust these straps as much as needed. So how's that feeling for you? All right. Our patient appears to be comfortable with this procedure, and as I'm going to go ahead and do an adult assessment again and just check their vitals, see if they've made a lot of improvement. So I see our pulse ox was at 85%, but now it's at 92%. I can still see though my patient is having difficulty breathing, and because he has a previous history of COPD and asthma, I want to go ahead and call med control because I think this patient is needing a duoneb or breathing treatment. So I'm actually going to go ahead and call med control right now so you can listen in on.
Evening, ER. This is Nurse Candy. How can I help you?
Yes, hi. This is Kayla calling from the Sugar Creek Fire Department. I would like to speak to an ER physician. I'm going to need orders for a patient treatment.
Okay, just one moment. Dr. Miller's on duty. I'll go grab him.
Okay, thank you.
This is Dr. Miller.
Hi, Dr. Miller. This is Kayla calling from the Sugar Creek Fire Department. I have a patient currently that is a 67-year-old male, and he's in respiratory distress. He actually has a history of asthma and COPD. We have obtained vitals. His blood pressure is 118/70. His heart rate's 80, and his respiratory rate's 20, but it's very labored. He has an SpO2 level of 85%. We currently actually have him on CPAP, but his SpO2 it did help some. His SpO2 is now at 92%, but because he has a history of asthma and COPD, I would like to administer a duoneb.
That sounds fine. I will give him 1 unit dose of duoneb.
Okay, awesome. So I'm going to repeat that back to you. I'm going to give the patient 1 unit dose of duoneb. Is that correct?
Correct.
Awesome. And then could I have your physician number?
890.
890. All right. Thank you so much.
No problem. See you in a little bit.
Yep. Bye-bye. So now that we've contacted med control, and because I'm a basic, I need to contact med control. If you have a paramedic with you, this might not be a step you have to take, but now that I have physician's orders to go ahead and do a duoneb, I'm going to go back to our basic box and go ahead and grab that. So here's our EMT drug box. We're going to go ahead and break this seal. Okay. So one of the important things to do is make sure that it does say that you're giving your patient albuterol. You want to make sure you have the correct medication. The other thing you want to check is make sure that has the expiration date, that it's not outdated. So this says January 20, so we're good on that. Another thing you want to keep in mind is, does my patient have any allergies to this? So, do you have any allergies to albuterol? Nope, he does not. So he seems like he's fine to take this. So we're going to walk you through this process really quickly. I'm going to go ahead and open up my medication chamber. I'm going to set this down. And we're going to go ahead and open up our albuterol. So this cap is just going to twist off. And this is 1 unit dose, just to clarify on that. So you're going to squeeze this into your chamber. Make sure it's all empty, all in there. Okay. So now I'm going to just close this. Something to keep in mind is this, you do not want to tip this, because if you tip this, it's just going to all come out. So you just want to have this ready. And you're going to go ahead and put your port, I'm going to go ahead and put the port together, so this is also ready to run my oxygen. So, turn this on. For a minute. Okay. So at this point, I'm going to go ahead and connect this. I'm not going to turn my oxygen on until I have this all connected, just so that helps the medication here. Then you're going to go ahead and we're going to go ahead and put this into our one-way valve, and just going to snap on. It's a nice firm twist on there, and as you can see, this might have come out. Let's reconnect that. Okay. All right. So now your patient's ready to receive treatment. So I'm going to go ahead and turn on my oxygen. And at this point, the patient, you can just coach them through breathing, just having them take nice, long, deep breaths and holding it for a second before releasing. And then we're going to keep checking our patients, keep assessing them, make sure that their vitals are okay, make sure that we can actually see improvement. But this should probably help our patient out.